We have a series of videos on common practical procedures in the Children's Emergency Department, so I hope you enjoy.
In this video, we'll be showing you how to apply a below elbow backslab cast for forearm fractures. First, measure your patient from 2 centimeters below the elbow joint to the head of their metacarpals. Then cut the plaster down to size. Plaster typically comes in 5 layers. Some practitioners choose to double this to make the plaster stronger. Once you cut your plaster down to size, use your patient as a guide to cut a small triangular hole where their thumb will sit in the plaster cast. A few tips: make sure the water for your plaster is tepid or lukewarm. If it's too hot, the plaster will dry too quickly. If it's cold, it will take forever to dry. As well as cutting a small hole in the cast for the thumb, make sure to trim off any sharp edges of the plaster. Some practitioners start with a layer of stockinette bandage to protect the skin. If you are starting with a layer of bandage, make sure that it's nothing tight like crepe that could restrict blood flow to the distal part of the limb. Now wind the padding down the patient's arm. Each twist of the padding should overlap with 50% of the twist above. Just tear a small hole in the padding for the thumb as you go. Avoid any wrinkles, as this will be uncomfortable when the plaster is on. Once the plaster is wet, lay it across the dorsal aspect of the patient's forearm, smoothing it down as you go. Make sure the plaster extends down to the metacarpal heads. While the plaster is still wet, you can apply first a gauze bandage and then, if you like, a soft crepe bandage over the top, winding it down the arm in the same way that you applied the padding. If you're using stockinette, you can roll it down here over the top of the cast to stop the rough edges of the plaster rubbing on the patient's skin. What isn't shown in this video is a neurovascular screen of the distal part of the limb. This should be done before starting to apply the cast and again afterwards, and obviously make sure to document your findings. Most departments have written information that you can give to patients and their families when they go home with a plaster cast. But if your ED doesn't have this, make sure to explain to the patient and their family how to look after a cast and how to monitor for signs that it's getting too tight. Finish off with a few strips of tape to secure the top layer of bandage in place. Next, apply a sling using a triangular bandage. The key is that the top of the triangle or the widest angle should go under the patient's elbow. Tie the 2 longer points in a knot around the patient's neck. If needed, you can use a safety pin to secure any loose flaps around the patient's elbow.